What you're looking at in this slide is a very deep gastric ulcer as seen through a video endoscope. You're looking at the first section here is a glandular stomach where the acid is produced and the mucus is produced. And then on the right side of the screen, you're seeing the epithelialized stomach that has no protection from the acid. And when acid gets heavily into this part, then the ulcer is produced, and you can see the ulcer here as outlined in black. The first thing that we want to do when we're starting to look at any possible ulcer case, or any case for that matter, is to watch the movement of the horse. Now, in the case of a horse who has ulcers, what we find is there's a tendency for the shoulders to want to roll inward with each stride as they're coming towards you, and also the pectoral muscles, the chest muscles here, instead of moving in an up and down direction, tend to move in a more inward direction. So that's what we want to have a look at. When the horse is going back away from us, what we want to look at is how much excursion there is in his pelvis, and height up and down, whether the tail is hanging straight, because generally these horses have got some significant pain in the croup muscles and in the SI joints, and so it changes their way of going. So that's what we want to try and look at when we have the horse walk towards us and then walk away from us. The key feature you want to observe when the horse is coming towards you is the way that the shoulders roll in and the pectoral muscles. It's most easy to observe the rolling in of the pectoral muscles with each stride. The key feature that you're going to note when the horse is going away from you is that there is asymmetry in the motion of the pelvis. That asymmetry involves the tail, carried off in this case, as you can see here, to the right. The croup musculature, as he moves, you will notice is flattened on the right-hand side, and the pelvis will twist to the right in a counterclockwise direction here. Now, this also affects the stride length on one side versus the other, because there is much more tension in the croup on one side than the other. Examination of the horse with ulcers. The first thing that we usually see is if we come down this portion of the brachiocephalicus muscle here, which is on the stomach channel in the Chinese medicine aspect of it. And what you expect to see is a lot of fasciculation and motion within the, and very, very uncomfortable. You see the twitching that he ends up getting here. And then the next place that you'll oftentimes find a problem is in a neuromuscular pattern where we trace up over the top of the scapula, down to the rib cage, and then up to the thoracolumbar junction here. And I'm using a needle cap, but you can use a ballpoint pen, you can use the tips of your fingers. But as we come around, you'll see the fasciculation that we get into here. And that's the neuromuscular response that I anticipate finding. When I start to find that, then the next step we want to look at is some of the acupuncture points that are consistently reactive. The first one that we will check is one that is associated with stomach on the back here, a back shoe point. And this is happens to be on the bladder channel, bladder 21. And you see the clinch response that I'm getting with very, very light pressure here. You should not have to be digging in to do this. If we come forward one rib space, we're in bladder 20, and this happens to be related to the spleen, which is considered the main organ of digestion in Chinese medicine, because of its association with the pancreas and the enzymes that are elaborated from the pancreas that aid in digestion. So this is the same response. Again, you see the twitch that we've got here. So here is bladder 21, and here is bladder 20, the stomach and the spleen. Then we can also check for the large bowel point, the point up here on the bladder channel called bladder 25, and that's right here. You see I'm getting that same type of a flinch response, and I can come here now to bladder 27, which is an association point for the small bowel, and you're seeing the same type of a flinch response. Now, you should not get any of those flinch responses. So just to demonstrate the difference, if we come up in this area where I'm dealing with, for example, the liver channel, you see same pressure, no responses here whatsoever. Now, having found those points all sensitive, I'm going to check another point down here that's associated with the stomach channel, and it's somewhat of an alarm point for the stomach. We're looking here at around stomach 12 point, and you see the response I'm getting there is quite reactive as well. Then we can come to a alarm point that is associated with the spleen, and for that one, it's at where the next to last rib goes from the rib to the cartilaginous attachment down here. So we're going to just stroke down, and as we get down about here to where the cartilage starts, you'll see again the next flinch response. There it is. The large bowel alarm point, stomach 25, you need to be in a very safe place and pay attention to safety. So I'm always placing rearward on this, and where this is, we need to locate the umbilicus for the horse, and then we're going to come out approximately 1.5 inches out here, and we're going to find just a small depression there, and when I stimulate that, you see I'm not getting any response on this one. And so what that is an indication to me that his problem is primarily in the foregut rather than having a lot of hindgut problem. These points up here for large bowel, small bowel were active, but it's only when I get this one in addition, the alarm point for that large bowel, that I'm really pretty certain that I've got a large bowel problem going on. I also want to go through and take a look at what other patterns may show up, and a lot of these are chiropractic issues, and this is not to say that the chiropractic will cure this in any way. This is to say that these are patterns that tend to show up when the horses have ulcers, and I'm only going to go over the ones that are highly consistent. The horse may have other chiropractic issues going on, but these are the ones that are consistent findings when we've got an ulcer problem. And so the key ones here are starting up here in the thorax with the 8th thoracic and coming down here. And what you'll anticipate seeing is that there'll be a lot of fasciculation as I come down here through that. You see it's carrying clear down here into the shoulder muscle. That's 8, there's 9, there's 10, and oftentimes 11 is there, but that's not as consistent. It's the 8, 9, 10 that I'm primarily concerned about. And then at the thoracolumbar junction, where we have the last thoracic vertebra, T18, and then coming to L1, L2, but particularly L1, L2. And again, very light pressure, and you see the flinch response that I'm getting in both of those situations. I think in his case, they're acute enough, he's going to have a little more in 18 and also going back to L3. But the L1, L2 are the keys there. Then the next area that is very, very consistent is if we put pressure right over the sacroiliac joint, it'll be right here, and it'll be bilateral. So you see as I come down through here, his tendency is to almost collapse down in his hindquarters. Those are the ones that are consistent. Now, there are also some other neuromuscular patterns that tend to show up with this as well, and that's getting into then the area of our muscle aspect from it. And so if I come down over the front edge of his shoulder here, what you're going to notice, and I'm going to change positions here a little bit, so that hopefully you can see it here, the response when I come down through here is that he's going to again show a pain response and drop his shoulder down and come to his head towards me. And that's the typical response. Because these chiropractic vertebral issues up here are present, he's also going to show a couple of acupuncture points down here on the shoulder that are going to be reactive and indicating that the muscles in the shoulder are not as free moving as they should be either. You saw the flinch there, triple 14. And you'll see a response when I come into what's considered almost a massive point for the shoulder, small intestine 9 here. Okay? And so you can see some horses can be pretty reactive on these points, so you always want to make sure you're in somewhat of a safe place. Now, having found those, every one of those same features has to be present on the opposite side. In other words, every one of these things are bilateral. And if I have any of those missing, I'm not ready to say this is an ulcer case. For the sake of the video, we're not going to go through those and repeat them all on the other side, but having tested them prior, I know that they are reactive. All right, now let's talk just a moment about some of the muscles that very typically show up. And again, because when you have this chiropractic pattern, your trapezius muscles will almost always be sore here, and many times what you'll end up thinking is that this horse is having saddle fitting issues, and when in fact it's just all related to what's going on with the ulcer patterns in here. So that is very typical, and when you have that, sometimes you'll also see a tremendous amount of fasciculation coming clear down here through his shoulder muscles as well, like that. Then we anticipate that he's going to be quite sore over his gluteal muscles, and the gluteal muscles, of course, are coming all the way in through here, and they are attaching, part of them at least, to the greater trochanter here. So when we put just flat-sided pressure with the needle cap coming through over the muscles, and a fair amount, he should be able to tolerate a lot of pressure. And this is a pretty light to medium pressure, and you see the response that I'm getting from that. And along with that, then many times the biceps muscles get involved here. They are not as consistent on the biceps, but if we trace down to the origin of the biceps, you see the response I'm getting here. Now, that's part of the reason why they don't have as much forward stride, they don't have as much lateral motion as would normally be available to them there. So that's, and then as we came over that front shoulder, we talked about it as a neuromuscular pattern, but it's also an indication that the cervical portion of the trapezius is involved here. And that, again, is restricting shoulder motion. This particular one is not typically on both sides, and I don't know exactly the reason, but it is always much more advanced, much more demonstrable on the right side of the horse versus the left side of the horse. So that's basically the diagnostic protocol on it. Then to help confirm what is going on, I go through and I turn around and treat points that are all down on the lower part of the limbs here. They're called command points. And what we will then find is that those test points that we had here, these neuromuscular patterns, and some of the other muscle patterns will get better. The points will disappear, the neuromuscular pattern will disappear, the rest of it will be somewhat ameliorated. There are many ways of treating acupuncture points, and for the purpose of this, and you see this horse is fairly nervous, fairly agitated, I'm going to treat using some strong LED lights, and the first point I'm going to start out here with is pericardium 6. I'm going to treat each one of these points for about 15 seconds. We won't hold the camera on for that long, but I just want you to get an idea of the general location of this point. And this point has a direct connection with the bowel, and is also a very quieting, calming sort of a point. The next point I'm going to treat here is a master point for the face and mouth. It has a large action also on the bowel, obviously. It is large intestine 4. All of these points are going to be treated bilaterally. We won't show treating them all on film, but all of them will be treated bilaterally. This point is also on the large intestine channel or meridian, and it's large intestine 11. The next point that we're going to do is a master point called stomach 36. And this one has a very good effect on the GI tract. And then the other point that we are going to do here on the hind limb is gallbladder 34, which is located in this area right here. And then with the legs slightly separated as they are, I want to be able to get in here, and I want to treat 2 points that are on the spleen channel. The first one is going to be spleen 4, which is a source point for the spleen. right in this area here. And then we are going to treat another master point called spleen 6, in which 3 of the main channels along the hind limb come together. And that's our spleen channel, our liver channel, and our kidney channel are all have an intersection there. So it has a marked effect on that. He moved a little bit, so we're going to get this spleen 6 point again. Now each one of these points I'm going to treat for about 15 seconds. We're not showing the full treatment time on the camera. And once again, I want to emphasize that these points are all going to be treated bilaterally. I want to go back and show you what our responses now are on some of these places where we tested here. I want to bring his head on up. And so now I'm using the needle cap on the flat of the brachiocephalicus muscle. You can see that that is now pretty much gone away. And then we had the neuromuscular pattern here and the trapezius muscle area in here. You see he's now no longer also going through here and having our flinch response there. So now if we come around through and retrace this pattern here, bring his head on up again please. Coming right straight through with the needle cap. And you can see we don't have that incredible flinch away response associated with that. And then we can come in and start checking our acupuncture points that we had checked before. Bladder 21, our association point for the stomach. You see he's not flinching, not flinching significantly when we come back through that. Coming one space forward to bladder 20 for the spleen. And you see again, not much reflex, no spasming there. Then we'll come back up here, check our bladder 25 point, large bowel association point. You see we're not getting any particular reactivity there. We'll come to bladder 27, an association point for the small bowel. And you'll notice that he's standing pretty relaxed, no significant functions going on there. Now, the other points that we checked, we're going to want to check down here again on our stomach channel and finding our stomach 12 point. And you see now he's allowing me to touch here. And many of these horses with ulcers are very difficult to groom or touch on their belly line. And that's oftentimes the reason why is that they do have stomach ulcers. Then we want to check our alarm point for the spleen. So once again, coming to the 17th rib, following that rib down to where it joins the costochondral junction here where the cartilage begins, and coming across through there. I got a flinch the first time. I have no flinch when I go ahead and repeat. When these points are active, usually the more times you do it, the more severe it tends to become. He was not reactive on our stomach 25 point, which once again, you would reach under from here, find the umbilicus, the belly button, and come out about 1.5 inches, find just a little depression there, and you'll notice he's not particularly reactive there. Now, some of the rest of the things, the chiropractic issues and some muscle issues, will be better, but they won't be gone. For example, if we come down here through the trapezius muscle back here, we're not getting much fasciculation or much tremoring there, and it's not carrying on down through the shoulder muscles in this area here. The other, the main area that becomes so sore are these large gluteal muscles, and you can see that I have relatively little reactivity in the gluteal muscles, and coming down through the origin of the biceps femoris muscle here, coming down through that area, once again, we're not getting that flinch and that dropping away from us there. So that's pretty much most of those areas that they are significantly involved. And sometimes they will show a lot of spasms in the paraspinal muscles and all as well, and we can discuss that a little bit more deeply. And he does have some soreness in these muscles in here. So from a diagnostic standpoint, that's what you're going to see. Then you may still end up needing treatment for the muscle issues, treatment for the chiropractic issues. However, having said that, just getting them on medication alone, after about a week to 10 days, almost all of these signs will have disappeared. That's been my experience, and it certainly has been pretty well corroborated by the response to the treatment and response to follow-up scopings and so forth on these horses. So thank you very much for your attention.